Chairman Deane, members of the Commission, I'm Rachael Deane. I'm the Chief Executive Officer of Voices for Virginia's Children. I just want to close this out today with an examination of the youth mental health crisis that's going on in Virginia, which I really think is unprecedented in scope and in the inadequacy of our systems to address the unique needs of children and adolescents that really can't be addressed in an adult system. We've heard from clinicians that some serious mental health needs in young people are even outpacing the adult mental health needs that we're seeing in the system right now. We heard in the JLARC report that students themselves are telling us they're in mental health crises. 64% of high school students reported feeling nervous, anxious, or on edge. 53% of students reported feeling unable to stop or control worrying, and then that sobering statistic of 13% reported having seriously considered a suicide attempt, and our teachers are deeply concerned. We heard that today. Even kindergarten teachers are concerned about the mental health and emotional health of their students, and parents are affected. 30% of adults with children in Virginia responded to the November Census Pulse survey and reported that they felt nervous, anxious, and are on edge related to the needs of their children. And as we move forward with recommendations, as we go into session, and as we anticipate budget announcements later this week, I want to point out a few things that some of the advocates in the youth space would like to see that are solutions specifically tailored to youth. I think absolutely we need more funding identified for those crisis stabilization units for children. I don't think it was highlighted enough today in the report that there are only 3 RCSUs for children across the entire state of Virginia, with only 25 beds across the entire state. In terms of workforce, absolutely. I think we need to look at those increased Medicaid reimbursement rates that we were able to use during the pandemic and find funding to go forward with those into the future. And a path to fully leverage Medicaid for school-based mental health supports. We have a huge opportunity now to leverage Medicaid with the reversal of the free care rule. So that would allow school divisions to bill Medicaid and receive a federal match for services that they're providing. I think given the decline in therapeutic day treatment, we need to pursue those strategies. And finally, with the schools, I think we also need to look to the standards of quality that have been set out for our public education system for many years. The specialized student support personnel is absolutely part of that. Senator Favola mentioned the support cap and how that's a bit of it's a ratchet. As you take positions out of that cap, it ratchets down funding for the remaining positions. So we are feeling hopeful about what Secretary Littell discussed today, but we really ask that as you move forward in this entire redesign of our system, please focus on the children and the youth. Their needs just can't be met in an adult model. Thank you.
Thank you, ma'am. Okay, is that it? Well,